Next slide, please. Sorry. Introduce our speaker for today, which is consists of. Do you know? Can you advance the slide just one, Joan? Oh, thank you. So before I talk about the speakers today, I wanted to introduce the mission of the Cancer Survivorship and Outcome Center. It's a center here at the Cancer Center, and our goal is to improve quality of care and resources for survivors and enhance quality of life in New Jersey for cancer survivors. We do have a number of studies ongoing, and one of our initiatives is to monitor unmet needs among our cancer survivors and implement best practice care for survivors in our catchment area, which is the state of New Jersey for our cancer center. Next slide. So we do have, in addition to our amazing lineup today, we have 3 additional talks, and they are on very interesting topics. The next one is Dr. Fong, and she is a kinesiologist who specializes in cancer survivors' physical activity. So she'll be giving a talk, but some demonstrations for physical activity for cancer survivors. In April, there's a talk by Katie Devine, who's an expert in adolescent and young adult cancer survivors, and she'll be talking about psychosocial concerns and post-treatment care needs. The last one's a very timely topic for many cancer survivors, which is managing lymphedema. Alyssa Bark, OTR, will be giving us some really great information on how to manage lymphedema. Next slide. And so at the end, if you're here and you're a cancer survivor and you can, we'll be emailing you a link. Here's a QR code, but obviously you're probably not going to put that up to the screen right now. But we will ask you just to fill out a questionnaire so that we know if there's other topics that you'd like us to cover. We will be adding a financial hardship and a financial navigation discussion by our head of financial navigation. I don't know what his title is, Jacinta.
His name is Charles, and he's the financial director at CINJ.
We'll be giving a really great and timely talk about financial needs among cancer survivors. And so I'm happy to introduce the social work team and let Joan take it away. Our next slide. Thank you for doing the slides, Joan.
Thank you for inviting us. So here's a list of the social workers that will be presenting this evening. And I'm Joan Hogan. I am the Oncology Social Work Manager at the Cancer Institute. And this presentation, we've entitled it Beyond Treatment, Transitioning from Cancer Patient to Cancer Survivor. So cancer survivor, the American Cancer Society considers anyone from the time of diagnosis to be a cancer survivor, no matter where they are in the course of their treatment. As you can see, high statistics on the number of cancer survivors as of January 2022. A cancer survivor can describe someone who was first diagnosed, someone who has just finished treatment, someone who may still be receiving treatment over an extended period of time, or someone with advanced cancer. Not everyone is comfortable with the term survivor, and there are many other phrases that others may use. So what does it mean, transitioning from patient to survivor? We'll be talking about all of these topics as the presentation goes forward, but it's about returning to a new normal when treatment ends. It's viewing the end of treatment for some as a new beginning. It may be reestablishing relationships with family and friends. There may be intimacy, questions or concerns post-treatment. There may be a lot of practical matters, such as going back to work, finances, the expense of cancer treatment. Health insurance may have to change. You may be looking at nutrition and wellness through a different lens. There may be environmental concerns. What are we breathing? What is in the soil that's growing our food? The biggest topic we come across as social workers is the fear of a cancer recurrence. And so it's important, we think, for anyone post-treatment to stay connected with their healthcare team. So a few things to consider. Definitely staying in the moment and taking one day at a time, sometimes easier said than done. acknowledging feelings and allowing time to process the events of the cancer journey. Very often, treatments may be very involved and a patient is in survival mode. When treatment is over, that's when one may really think about what they've been through. And so we'll talk about some of the things that can be done to process. This is a few suggestions: are journaling, being creative, crafting, mindfulness practices, joining support groups, which we run several at the Cancer Institute, seeking professional counseling if that's needed, and being sure to do things that you enjoy. And that could be anything: gathering with family and friends, relaxing, exercising, spending time in nature. And an important point is to be kind to yourself. Just because treatment is over doesn't mean you are physically back to normal. It's time to think about the future and maybe make plans for the future. Something that a lot of patients post-treatment may be fearful of doing. Again, viewing the end of treatment as a new beginning.
Okay, so my name is Gabrielle Vitaliano. I'm one of the social workers here at the Cancer Institute, and I specifically work with the breast team. And I'm just going to talk a little bit about coping with your emotions, post-treatment and inter-survivorship, a little bit of what Joan has already mentioned. But as social workers, we're talking about coping with your emotions all day long. We recognize how important it is to do this through your cancer journey, but that sometimes you don't really have time to do that when you're going through treatment, scans, doctor's appointments. There's too much going on, and that's when you hit a point of survival mode. And so usually it's at the end of treatment, when you enter this survivorship world, when you really have time to kind of acknowledge and process what you've been through. And sometimes that's not easy to do. A lot of emotions may come forward, but know that whatever emotions come forward during this time, it's okay and they're valid, and your body and mind just need some time to process these things. So you may be feeling sad or anxious, angry, fearful, and all of these things are normal. It's just a matter of figuring out how to cope with them now that you've reached this point. Processing of these emotions can happen with friends and family if you have a really great support system, but oftentimes professional assistance is needed in this process, talking to someone like a therapist or finding a support group. As Joan mentioned, we run several support groups here at CINJ, but there's also many in the community based on whatever diagnosis you have. And we have some resources at the end of this presentation where you can find some support groups outside of CINJ. And we understand that finding a therapist is not an easy process, especially nowadays, but oncology social workers are here to help with that, even post-treatment. So it's something you can think about and lean on your supports and reach out to us if you need assistance with that process. A combination of professional, peer, and personal supports will really benefit you through this transition. In acknowledging these emotions, you may feel frustrated and angry as you transition to your new normal, because you're not bouncing back as quickly as you may have liked. Your body may look different, you may feel different, your life has probably changed a lot since you were first diagnosed. So it's just important to be really gentle with yourself on this journey. You went through something very difficult. So now as you transition, be very gentle with yourself, allow yourself time to process and get back into this new world. And it's important at this time to make time for self-care and time for rest. Being positive and feeling gratitude all the time is not sustainable. Toxic positivity is a real thing. So surround yourself with people who will allow you to feel all your emotions, good and bad. Hold on to those people. And this is where support groups are really great, because there are people who have walked similar journeys and can really validate what you've been through. Some forms of self-care may look like physical activity, adequate rest, but just whatever works for you. Just be very gentle with yourself and kind to yourself. It could be very small things, but they will make a big difference on your journey here.
So my name is Rose Slazeski, and I'm a social worker here at Rutgers Cancer Institute. And I wanted to take a little bit of time to talk about fear of recurrence. Now, I'm sure that this is not a topic that is going to surprise anyone. And my guess is that everybody has probably experienced some of these feelings of fear of recurrence already, right? So important things to remember is that this is a pretty universal fear. And so you're not alone in this. And it's important to realize that it's very normal. It's very understandable. You've been through a lot with your cancer diagnosis and your cancer treatment, right? And as Gabrielle before me was talking about, there are ways to manage your feelings and emotions. One of the things that I'm going to say is that I don't think it's ever very helpful to just deny that you're having any kind of feelings. And that includes the fear of recurrence. So, but how to manage that fear, right? So that fear will come up as it does for pretty much everybody who has been through this journey. So that fear will come up, and then what is it that you will then do about that fear, right? So there have probably been techniques and strategies that you use during your cancer treatment that helped you cope. There are, one of the things I'm fond of saying to patients, that I interact with is have your feelings, but don't live there. Right. So it'll be very difficult to sort of go on and live in your day to day if you find yourself stuck in that fear of recurrence. Right. So you want to have your feelings, acknowledge them, be very gentle with yourself. And then, okay, now what? Let me move on. Right. And you might have used cognitive behavioral techniques to deal with some of the feelings that you have had previously. So those same techniques that you learned when you were going through your cancer treatment of maybe reframing negative thought patterns or fact checking what your brain is telling you with what your doctor is telling you. Sometimes we kind of catastrophize, right? So there are ways to manage your emotions, and it's important that you know what your own coping style is. So I think that that's something most people, as they have gone through this cancer journey, have gotten a little bit of information about. Know that there are probably going to be some triggers, and this is pretty normal. And triggers could include just having to drive into New Brunswick, or having to go to the hospital for something, or having to come to the Cancer Institute for just a regular checkup, right? Because, in follow-up. So that could be a trigger. Treatment anniversaries, that can be a trigger. Any part of your senses, so sight, sound, food, smells, certain words, certain songs, certain, and when you experience a trigger, you could experience that not just in your mind and with your feelings, but you can have, a somatic response. Your body can feel a certain way when you find yourself being triggered, right? And then also watching a newscast about cancer, or reading something about death, or even learning of another person, a friend or a loved one's death associated with cancer. Those can be triggers as well, right? So what's going to be important is to focus on enjoyable activities, focus on life beyond cancer, right? Allowing yourself to sort of come back to whatever normal looks like now. It's very important to seek out professional help if you need that, and if you feel like that would be really helpful for you. Asking for help there's no shame in that, and it actually is a really positive thing to know when it is that you need help and asking for that help. So having a survivorship plan when you go for your medical follow-up, that can be really helpful. Knowing what your survivorship looks like, reviewing the risk of recurrence with healthcare teams. And, it's not uncommon for doctors to say, okay, so in your particular case with your particular cancer, this is the rate of recurrence. that can sound like it's said very sort of nonchalantly by medical professionals, but they're really trying to help you understand what the risks are. And that's a piece of information, but if you find that information sort of running and running in your head, then it's time to engage other techniques, right? So it's important, again, to engage in those things that you find enjoyable. Give yourself the opportunity to do something creative, to get out in nature, to do activities that maybe you couldn't do before when you were going through your cancer. Using guided imagery, using other techniques, whether that's doing some journaling or something like that. All of these can help you manage that fear and make sure that you are having fear, and fear is not necessarily having you. Okay. But again, fear of recurrence is incredibly normal, and we would really be remiss if we didn't discuss it a little bit. So I'm glad we were able to discuss it to some extent. And if you have further questions or concerns, you know how to reach us. I see there's a question here. I don't know what we've decided to do with questions, but I see in the chat that there was a question about hearing that once you've had one kind of cancer, it's possible to have another kind of cancer. I'm a social worker, so I don't want to make any medical statements, but that is not an unusual thing, that sometimes, depending on what kind of cancer you had, you may end up with a second cancer. But that, again, that is very specific, and you should ask your doctor and your medical team whether or not there's any risk of that for you, given the treatment you had and the kind of cancer you had.
Thanks for fielding that, Rosemary.
Hello, my name is Elizabeth Brady, and I'm one of the social workers here at Rutgers Cancer Institute here in New Jersey. And I'm just going to be talking about just one of the many wellness practices that you could start to incorporate into your daily activities. And that's mindfulness practices. And mindfulness is a wonderful tool that can help us cope with stress. It can help us cope with symptoms of anxiety and depression. It can often even help with issues sleeping or easing pain. It is an evidence-based research that demonstrates the benefit of mindfulness-based interventions can in fact help reduce that stress and enhance our overall well-being when done alone, and both in conjunction with other stress reducing interventions. For instance, some forms of exercise like mindfulness while walking, or doing yoga or Tai Chi, even mindfulness when we're eating or listening to sounds can be helpful. A good thing about mindfulness is that we can incorporate it and practice it wherever we are. It's not a place that we need to be to practice mindfulness. Commonly in survivorship, people experience feelings of uncertainty. Often there's a big change in our lives, and we might even feel a loss of control. So mindfulness is one of the ways that we might be able to help cope with some of those feelings and process some of those feelings. So mindfulness is about sensing and feeling in the present moment. It helps us really invite curiosity, acceptance, acknowledging feelings, thoughts without judgment. And it can often help people, acknowledge difficult emotions rather than just kind of pushing them away. It can also help us become aware of bodily sensations. And it's about really, again, observing these feelings and these sensations in the present moment without judging ourselves. Mindfulness can help us live in the moment, be present with our loved ones, maybe finding new joys in life, maybe finding simple pleasures, and just kind of noticing the small things in life that we're thankful for. So mindfulness can also help us enhance the practice of relaxation. Again, helping with, sometimes sleeping issues at night or just breathing and taking a deep breath. And then mindfulness can also help us not just identify some of our thoughts and feelings, but maybe acknowledging some of the unwanted thoughts and practice kind of letting those thoughts go by refocusing ourselves to the present moment. Mindfulness is another great way of helping us build self-acceptance, again, loving kindness and giving ourselves that compassion that we all deserve and need. There are many apps available to help you practice mindfulness. We offer some mindfulness and guided imagery monthly here at the Cancer Institute, virtually on Zoom. But you can also download applications on your computer or phone to practice this. There are also free meditations on the internet, on websites, YouTube, and things like that. So other ways we can express and process feelings might be just using creative outlets to really provide us with that nonverbal activity to help us, again, reduce stress, reduce anxiety, process the cancer journey that we've been through and are still going through, and just provide us another way to cope and to heal. And using some creative outlets can also help us build resistance and again, help improve our overall quality of life. So some examples of ways we can be creative might be journaling, maybe writing a gratitude list, poetry writing, painting, art therapy, crafting. Things using our hands can be helpful, like gardening, sewing, knitting, using our bodies to be creative and express our feelings and emotions. So maybe dancing, singing, playing a musical instrument. Music can be, music therapy can be very beneficial as well. So before we move forward, I was going to do a very short mindfulness breathing meditation, if that's all right with you. And mindfulness meditation and guided imagery is an activity where we deliberately take the time out of our days to consciously sit for a moment and take the time for ourselves to cultivate and focus on mindfulness. So I'm going to ask everybody, if you're sitting, to just find a comfortable position. And if you feel comfortable, maybe gently allowing your eyes to maybe focus on something on the ground or in front of you, or maybe even close all the way. Adjusting any clothing that might feel uncomfortable. Making sure that our legs are uncrossed and our hands are uncrossed and just our arms are gently resting by our sides. And now that we found that comfortable position, again, if you feel comfortable, lowering your eyes, just let yourself relax in this moment. And I'm going to ask that you just allow your breath to be natural and normal. Maybe sitting still in this moment, we can allow our bodies to just become a little bit more calm and relax. When practicing mindfulness, it can be helpful to sit. So our back is straight, yet relaxed, and our heads are resting on top of our spine. Since the sitting posture helps us stay awake and feel this sense of dignity, self-respect. Maybe we feel grounded with our feet flat on the ground or touching the couch or the bed or wherever we're sitting. And as we sit here in this moment, allowing our breath to be natural and normal, I'm going to ask that you focus on the breath and that we use this breath as an anchor for this meditation. And at any time, if you feel distracted by a thought or a feeling, don't judge yourself. It's okay. It's natural. It's normal. I'm going to ask that you try to be kind to yourself. Acknowledge the thought. Maybe even label that as thinking. And then if you're able to, gently let that thought drift away like a cloud in the sky. And then bring again your focus back to your breath in this present moment. Bringing your awareness to that breath. Maybe you're focusing on the air coming in through your nose or your mouth. Maybe you're feeling cold or warm of the air coming in and going out. Maybe focusing on your breath. It might be helpful to think to yourself, I'm breathing in right now. I'm breathing out right now. Breathing in and breathing out. Maybe we begin to notice a pattern of our breath in and out. Maybe we start to focus on the breath and how it moves through our body, and our chest might rise and fall or inflate and deflate as we're breathing in and we're breathing out. Again, we're breathing in this quietness and control in this present moment, giving ourselves time to be here in present moment. And maybe every time we breathe out, we can just let go a little bit more of that any tension we're holding, any feeling of fear. Breathing in and breathing out. And again, each time your attention wanders off, that's okay. That's normal. That's natural. Let's just practice noticing where our mind goes. And then gently and kindly moving your attention back to the breath, back to your body, back to this present moment. Without any struggle, without any force. Be gentle and easy with yourself. Use these few minutes to relax and let go. And when you feel ready, slowly open that awareness up to the room that you're sitting in, maybe the noises around you. Maybe letting your eyes gently open. Maybe just pausing for a moment before you open your eyes and taking a moment to feel any sense of calm you might have achieved in just these couple minutes. And as we open our eyes and reconnect with everything that's around us in the room, hopefully you feel a little bit more relaxed. This was just a very, very short meditation. Sometimes we do meditations for 15 to 20 minutes, and it does take practice. And it is helpful to practice this in the mornings, in the evenings, or throughout the day, whenever you need to center yourself in this present moment. So thank you for participating with me for those few moments.
Thank you, Liz. So, making healthy lifestyle choices after treatment is a good time to take a look at what you're eating and drinking. And ask yourself, are there any improvements you can make in the quality of food you're consuming? We're lucky to be living in an area that offers an abundance of farmers markets. We have health food stores, and even our regular supermarkets are carrying a lot more variety of organic produce. We might think about scaling back on processed and sugary foods. When you really start looking at labels, it's amazing how much sodium is in some of the processed products that we're purchasing. Maybe now is a good time to consult with a nutritionist. You can ask your healthcare team if they could, provide a referral. You can ask your primary physician as well. Maybe prepare more home cooked foods versus eating out. Another topic that comes up frequently are supplements. Should you be taking them? That could be a whole presentation on its own. We suggest checking with your healthcare team before taking any supplements. Supplements are not regulated, so they may be different from company to company. Always check with your healthcare team before starting anything new. There's a lot of information and research on foods that are linked with cancer, causing cancer, and then there's always the question of what about alcohol? Maybe you've been told to stay away from alcohol, wine or beer as you're going through treatment. Again, check with your healthcare team. You may be feeling a little bit more energetic now that you're done with treatment and wanting to participate in physical activities. Take your time, engage in physical activities at the time of day when you feel most energized. Start slow. You can set goals. Keep your routine flexible. Be patient with yourself. Walking is a great exercise. It's free and you can go at your own pace. Also, consider balance training. There are a number of programs that offer balance training. And now that, programs are coming back in person, you may have the option of being in person and getting instruction that way. There are many free or low-cost exercise programs for cancer survivors. We've listed a few at the end of the presentation that will be shared with you.
Hello, my name is Lauren Camposano. I'm one of the social workers here at the Cancer Institute, and I'm going to be addressing needs and concerns surrounding relationships. So relationships with family and friends may change after treatment, just as they may have during your time of treatment. Prior issues may resurface. Family and friends may seem less supportive. And for them, it may just be business as usual after treatment. That may be the expectation. They may be less available. Remember, they were impacted by the diagnosis and treatment, and they're also adjusting to a new normal as you are, and trying to find a balance. So everyone will need time to adjust. So to address concerns or the changes in your relationships, communication is going to be key here. For reestablishing relationships, communicating your feelings with your relationships with those close to you. It may be helpful to tap into a professional counselor to assist with initiating and having these conversations to discuss your needs, or to process the feelings regarding your relationships and how they may have changed over time. Cancer treatments can also impact the sexuality and sexual function in different ways. Side effects can be both emotional and physical, and can they appear after treatment in addition to during. So side effects that you may experience for men: erectile dysfunction, pain during sex, decreased libido. For a woman, vaginal dryness, pain, difficulty having orgasm, numbness, decreased desire, and early menopause. So these topics are sometimes difficult to discuss, even with an intimate partner. It's not uncommon to be hesitant to talk about this with your healthcare team if you feel embarrassed or uncomfortable or feel that the side effects are not as important as your recovery from cancer itself. We encourage you to speak with your healthcare team to discuss these sensitive issues, as they may be able to offer recommendations. It is important to care for yourself in this way. You deserve to have these needs met, and this can help with self-esteem and supporting your mental health overall. As a survivor, you may be self-conscious or struggle with self-esteem due to the changes in your body that you've experienced. These changes can be difficult to accept at times, and it's important for this reason to acknowledge aspects of your body that you feel positive about. A survivor may still be coping with treatment side effects, and it's important to acknowledge that. You may find that intimacy means something different for you now. Hugging, touching, holding, or cuddling may be more important than sexual intercourse. The important thing to remember is that there's no right way to express your sexuality. It's up to you and your partner to decide together what is satisfying and what your needs are. Sharing feelings open and honestly to ensure good communication is so important here. Voicing your concerns that you have is an important step so that your concerns can be addressed. A partner may need assurance that you're still interested in intimacy, or a partner may be concerned that intimacy is uncomfortable for a survivor. Allow yourself to be loved and cared for. If this is a stressor, you may want to consider joining a support group specifically to address intimacy concerns, or reaching out to professionals who have experience in this area, whether that be one-on-one or with your partner.
Hi, so Rose again, Rose Lizeski, social worker here. So at this point, we're going to be talking a little bit about practical matters, because there are a lot of, we've talked a lot about the emotional aspects of survivorship, and yet there are very practical matters that will come up, right? So returning to work is a practical matter for some folks, and so engaging in a regular schedule, a regular pattern of activity, this can aid in the feelings of normalcy that we're so sorely lacking and missing while you were going through your cancer treatment. So work may be a possibility, and it may not be a possibility. So just I'm just going to say that much at this point about that. If it is a possibility to return to the job that you had, know that that job may be somewhat different, and you are likely going to be different. And because of those things, your work environment is not really going to feel particularly the same, right? Your relationships with the people at work may be somewhat different after going through cancer treatment. And whether you've worked all the time during your cancer treatment or some of the time during your cancer treatment, and then there are going to be some things that won't be different. So despite the fact that you have gone through this major life-changing event, people at work who were unpleasant, unkind, they will likely still be unpleasant and unkind. Your cancer diagnosis and treatment will not necessarily change their behavior. But you may have fresh eyes with your work experience. So your environment, like I said, may be different. You are not responsible to share with everybody who asks what your cancer trajectory looked like, what your cancer treatment involved, how you're feeling now, whether or not there's any risk of recurrence. You get to make very clear choices about what you are and aren't going to disclose. And as with all relationships, appropriate boundaries are really helpful here. There's no reason that you have to disclose certain things to people who are sort of dotted line colleagues. It may be the case that there are some things that you do have to disclose to your employer, especially if you need reasonable accommodations when you return to work. So the Americans with Disabilities Act makes it very appropriate that you have reasonable accommodations, because there may be some residual impact from your cancer and your cancer treatment, that whether that's physical or whether that's a little bit more mental, whether you're experiencing some fog. So know that reasonable accommodations are part of what is something you can have an expectation about. And yet you do have to disclose that you need a reasonable accommodation. So perhaps your job involved a certain amount of lifting or physical work. And if that's not something that you can do, but you can still do your job, but you need an accommodation around those physical things, there will need to be some sort of, will have to talk to those people who are in human resources and those people who are perhaps your boss to discuss what kind of accommodations you need, whether those are physical or sometimes mental, because having post-cancer chemo brain is not, that chemo brain is a real thing. For most folks, it does dissipate pretty, it can dissipate very completely, and sometimes it does not, and it kind of hangs on. So just know that as far as disclosures, in order to have a reasonable accommodation, you do have to disclose what your limitations are due to your cancer diagnosis, okay? So sometimes it's helpful to decide in advance how you want to answer certain questions, right? And which questions you're not going to answer. And if they come up, how you will then deal with that, how you will address that. Having a bit of a plan can sometimes help, right? And it is important to be proactive in asking for what it is that you need, right? So you may need privacy, right? Or you may need not to be thinking about your cancer every day when you're coming back to work, the fact that you have gone through cancer and cancer treatment. So, some self-awareness about what it is that you're going to need, and how you perhaps are going to ask for that from the people at your employment. So there are some resources that are listed here on the slide: Cancer and Careers and Triage Cancer. You may feel that you're experiencing some discrimination, or perhaps you need some real guidance about what you're able to, ask for as far as reasonable accommodations and things like that. So I do think that it's important to take note of these, resources that are listed here: Cancer and Careers and Triage Cancer, both two very wonderful organizations that can help you. Okay. Now, about returning to work, it is something that's probably helpful for some folks to know. If you had to go out on Social Security disability, the Social Security Administration does have something called the Ticket to Work program. And so there's what's called like a trial work period. And then you can start back to work, see how things are going, and you don't have to lose all of your Social Security benefits. You can still receive while you're, trying out work. So the way to find out more about that is to go to the ssa.gov website, which is Social Security Administration, and you can just even put in the search Ticket to Work. And actually they have something on that website that's called, I think it's called Rebecca's Story, but it follows one particular cancer patient and her Ticket to Work experience. So I think that might be helpful for some folks if Social Security disability is something that you have needed during your cancer experience. It is not uncommon for people to experience a lot of financial challenges associated with going through and even post-cancer treatment and care. So that may be your experience. And so you may have out-of-pocket costs that have to do with, co-pays, deductibles, co-insurance, and you may have had quite a bit of out-of-pocket expenses that have made finances tight and a little bit difficult, right? So not only can cancer impact your ability to work, but it can impact finances in a pretty strong way. And so there may be some debt associated with that. And that may be something you might, need to seek out professional help with, whether that's through an accountant or whether that's through some debt relief, or perhaps, some entities, foundations that provide one-time financial support may help you bridge sort of that gap as far as some of the financial toxicity. But it can be a hardship. One of the things that I think is probably important to realize that returning to work may mean that there's some role reversals and role changes, which may also have occurred when you had to stop working. So if you had to stop working and then, your partner, your loved one, different family members may have stepped in and there may have been some role changes. And then if it is the case that you're able to go back to work, then there's some emotional things to navigate there too with going back to work, and roles can't necessarily always switch in one direction and then switch back without without some real emotional components that have to be addressed. So just one thing to discuss and think about a little bit. Medical insurance, your cancer experience may have changed. Your job status, it may impact whether or not you have insurance. It may impact whether or not you have a job and whether or not you thus have insurance. You may not be appropriate for a federal program yet, whether that's Medicare. Maybe you're not old enough for Medicare. Maybe Medicaid is not appropriate. So there's the marketplace, and it's important to know what some of the rules are as far as getting assistance through the marketplace, and whether or not pre-existing conditions are always not going to be considered. So more research on your part is necessary depending on your situation. And there are SHIP volunteers. These are in the state of New Jersey. There are volunteers that can counsel those 65 and over about what their insurance options are. And these volunteers will meet with like I said, individuals over the age of 65 and assist them in figuring out, what might be most appropriate for them. So there are a lot of nuances to this information, and there are a lot of nuances to figuring out if going back to work is for you, or whether or not maybe you're not going to go back to work. Whatever you decide, ask for the help you need, and always be gentle with yourself. Every transition is challenging. And that includes a transition of either going back to work or deciding that, you're not going to go back to work and you will be retired. So I've probably said enough on that. Thank you.
Thank you, Rose.
Okay, I'm Erica, Erica Ames. I'm a social worker here also at the Cancer Institute. And it's my time to shine, and I'm going to keep it brief because I want to make sure that there's time for questions. So we're going to talk about a survivorship plan, where I get the honor of combining all the things that my colleagues just talked about and how we put it all together. So a survivorship plan is a record of your cancer treatment history, as well as any checkups or follow-up tests you might need in the future. But I'm going to tell you some other things that we want to include in that plan. But first we'll talk about why. So why have a plan? Number one, it's a way to organize your medical records for any other providers you might have in the future, and to assist with effective communication. It's also useful to survivors and their family members to have documentation should it be needed for the future. So for other healthcare providers, like I mentioned, documentation for children and grandchildren, having the documentation that may be needed for maybe your cancer was caused by environmental exposure and you need the records later on to prove that it was. I'm thinking of those commercials about mesothelioma. And then, it's also important that you gather your medical records, because medical records are legally only required to be kept for 7 years. So, you may be 10 years out and find that your medical records, your provider no longer has those records. So you want to make sure that you have them. And then you also want these you want to implement a survivorship plan that includes not only the care plans and the medical stuff, but also other services that you might need or want in the future. And it recognizes that cancer survivors have unique healthcare needs, but a survivorship team can consist of, the people you probably had in your during your cancer treatment, but also you want to include friends and family and other people, maybe other survivors that or support groups for survivors. You want to involve your community in your plans. And so you also want to manage, have a place to manage the lasting physical effects, the psychosocial issues that are related to having been a cancer patient. So mental health concerns that Gabrielle talked about, having support systems and dealing with relationship changes like Lauren mentioned, any changes in, self-perception. Some people find the label survivor to be a badge of honor, whereas others might find it to be a burden and want to get as far away from anything cancer related as possible. So having a plan for how to manage that, the occupational plans that Rose just mentioned. And you want to, and then those wellness priorities that Liz talked about. You also might want to keep your advanced directives as part of this plan. And you can store this plan in like a bunch of different ways. If you're more of an analog person, maybe a binder, a file cabinet, or a fireproof document box. Or you could store it digitally. You want to make sure it's secure, but like a flash drive, or if you don't want to keep up with a flash drive, using something like OneDrive or Dropbox. There are tons of services out there that you could use, a lot of them free. And you want to involve the people who are important to you in those plans. And so I will turn it back over so that we can get to questions.
Thank you, Erica. Okay, there are, we have resources listed. We don't expect everyone to jot this down in the moment, but I'm sure Dr. Manny can gather all the resources and maybe send them out to you if you're interested. Here are just a few of the online workout classes that we refer patients to. And the meditation options that Liz was talking about, and the meditation apps that you can download. And here's just a list of resources. So these are organizations that we typically refer our patients to. Crossroads for Hope has a full supportive program, as does any cancer support community or Gilda's clubs. Mary's Place by the Sea is a wonderful resource for women. They have support groups and a lot of services. Cancer Hope Network, Cancer Care, Komen, Us Too Prostate, and there is support for anyone with a head and neck cancer. So I believe, oh, here we go. Dr. Manny, this is your slide.
Yeah, so we'll be sending out the handout, sort of a flyer that we have to everyone who's here today. And then the next slide, Joan, do you have it? Yeah, so if you're interested in receiving the resources, let Jacinta know, or Jacinta will probably just be emailing everything to everyone. There are recordings of the talks that have been given to date. There was a talk on nutrition. It might be of interest to people who are here today, because it was by a nutritionist. She did cover all of the information about multivitamins, which was really interesting to hear because I didn't know much of it. And then we do have the remaining 3 talks. I want to highlight that we will be having a 4th talk on financial hardships among